listening to AM Ocala Live, WOCA, The Source, 96.3 FM, 1370 AM, broadcasting to you live from the Paddock Mall, streaming live, YouTube Live, WOCA, The Source Radio. Oh, yeah. And 18 minutes before the top of the 11 o'clock hour, as it is time for County Commission, as we have Kathy Bryant in the studio. Good morning, Kathy.
Good morning.
And we have from the Marion County Department of Health, Mr. Mark Lander. Good to see you again, my friend.
You too, my friend. Thank you for having us.
You got it. So welcome to the show. As we got some time to talk about what's going on within our community. Last week, Mark, Kathy, and I, we discussed the facts, the numbers. And here you're here today to verify. Yeah, that's what you guys were talking about.
Absolutely.
Percentage is down. It's flattened.
It's flattened, and we're at a very important time right now. With opening back up and having more potential areas for exposures. It's really, the department is really pushing our message of continue safe mitigation. Distancing. We need this. We've been really restricted for so many months and in the weeks, and there's all the alternate effects that take place within the quarantine. You have the mental and the social aspects that happen to it.
Sure.
I think we saw the benefit of from as far as the virus goes and seeing our curve flatten.
Right.
We do, even as we increased our testing capabilities, which we really did for the month of May.
Yeah.
We had especially the last 2 weeks in May, I believe we had run about 6,000 tests over those last 2 months, really pulling some numbers up.
Right, which I think is people need to hear that, because I think maybe that there was a misconception. At least I heard in a few conversations I had that they're like, are they even doing tests? Yes, they are. They ramped it up.
I've heard that since March 20th. and that was well, you're testing, and you talk about, well, we're testing, and I've talked about it with Commissioner Bryan over and over. We started off testing the sickest of the sick, the individuals that we thought would be positive, and we were coming in with that positivity rate of about 3%.
Yeah.
Whether we had 40 tests, 400 tests, 4,000 tests, we were hanging in there right around 3%. We really ramped up the testing, brought in more partners, brought in Marion County Fire Rescue, Ocala Fire Rescue as testing partners with us, getting out into communities. And I believe the numbers were 2 weeks ago. We did about 3,500, and then around 2,500 last week. The last week in May, really we tested over 2% of the population in May. Just in that 1 month, and the numbers. You keep seeing our positivity rates. We're going to continue to go down, and that was expected.
Sure.
When you increase numbers like that. I think what was encouraging. We really felt like our positivity rates would drop, but we would see a huge increase in cases.
Right.
We did. We saw our positivity rates drop, and we were there again averaging 12, 13, 14 cases a week. It seemed like we're coming in around 2 a day. It's very important now because there's more exposures. There's more opportunity to become in contact with somebody who may be COVID positive, and so that's why we're really stressing the message of, if you're out in a crowded area, have a mask.
Yeah.
If you can't maintain your social distancing, and also some of the messages are to really push for home health.
Okay.
We've seen quite a bit lately where we have large families coming in. We may have an anomaly or a number we're seeing. It's just seeing 1 or 2 a day, and we may have, we had 8 cases today. When you really go look at it, well, we had a family of 5 or a family of 4 or 6, and those, they're still the positives, but we're seeing those. That's interesting. We were seeing family contacts, but it was more, like maybe a husband or wife, and then now we're seeing it start to expand a little bit. So we're putting the message together. If you're taking care of someone who's COVID positive at home, please make sure that you're protecting yourself and your family at the same time. If the individuals, they really should be isolated in their own room, given their own room, preferably their own bathroom. You can take care of them. Make sure you're masked, they're masked when you're assisting them at any point.
Right.
Clean their surfaces constantly in their rooms. Avoid the limit exposure. If it's a large family, understand for the next 2-week period, it may just be one person is that designated caregiver. And that one designated caregiver for that individual, if possible, should isolate as much as they can from the others as well.
Right.
Because that in the event that they were to become infected, that way they don't spread it to other family members. But that's the message that we've really drafting some of our messaging to focus on that to reduce the large family infections.
All right. Of those numbers, what was it at for actually hospitalizations for COVID positive patients?
I don't have the current date from where we are today. Did you pull that one in?
We'll pull it up right now. So do you want cumulative or do you want as of last night?
Cumulative.
Okay, so cumulative, I got to go to a different place.
Oh, gotcha.
I think cumulative is around 35 to 30.
I think it's around 36, actually, but I'm not sure. That's cumulative. Right now, we're at 5.
Yes.
Gotcha.
But over the course of the event,
Okay.
hold on. I'll get the latest number while Mark.
Then that's how they try. When you talk about the cumulative piece, that's how the state is recording it on their website.
Right.
And if you've ever been in the hospital or hospitalized for any point in time, you're counted as a hospitalization.
Right.
Whereas the county, we have our separate numbers that the commission is working with our emergency management, who is in close contact with each hospital, and they track who is currently in that hospital, which is an extremely important number. When
Sure.
we can talk about looking at the positivity rates and the numbers, but at the reality at the end of the day, when you and I've talked about this before, the overwhelming of the healthcare system. So the numbers that they're pulling in specifically for what do our hospitalizations look like, that lets us know what we have ICU capacity, bed capacity, ventilation capacity, and that's really the important number when it comes to providing healthcare services.
And that is where that adds more substance, Kathy, to the not necessarily to the argument, but to the conversation about where we're at when we mentioned talking with Governor DeSantis about saying, hey, this is our community. We've seen how hard you guys have worked, Mark, with getting that information there to say, okay, this is where now, Kathy, on your side of it is saying, okay, so now what matters is getting people the opportunity to do something like work and get this economy going back and starting to do it to get that normalcy. And Mark, I'm sure you're just like you did. You're talking about the idea, okay, yeah, let's do that. However, let's still stay responsible. It's something her and I have been talking a lot about. Still with all the stuff there of knowing that we still want to, wash our hands frequently. We want to, cover our mouths when we cough. If you feel like, wearing a mask, if you feel like you might be one of the ones that are still, so to speak, threatened by it, or if that's the case too, maybe not even leaving the house yet. But with how hard you guys work to put these numbers up, that's the meat and potatoes of the conversation on the other side that Kathy's trying to have to say, hey, okay, if that means these folks have done their part and we flatten this curve, what does that mean next for actually getting things back open? And that's what a lot of people I know are thinking.
And I think as Marion County residents, we've shown what we can do, and now then given the opportunities to expand with release some of the quarantining, we've shown what we can do. So, but now we have to continue.
Yeah.
Now it's back on us. We did what the governor had asked. We did the proper isolations, but now it falls back on us as citizens in our community to continue to use those protective measures to show that this is the right step to move forward. And this is understanding that we have a virus that's going to be here.
Right.
So how can we be good community citizens, residents of Marion County, and protect our neighbors as well as our families and ourselves?
I read this morning, there was an article that had come up fairly fresh. It was early this morning, but they were discussing a little bit more of the conversation about where a vaccine could be at some point. And one of the things that was interesting about it was that because of still the information that's necessary to find out about this virus, it was I guess to the idea that it might not even be a one and done type of vaccine that would come out. It might be a double shot, where you get 2 following that up. So that tells you right there that even with the vaccine, there's still going to be some responsibility there, because even though you have had that, doesn't necessarily mean, and we don't even know when that's coming too. So that's one of those things either. So it's one of those things altogether.
I read an article as well the other day that they had polled out of 42% or 49% of Floridians said that if a vaccine was available, they would take it.
Yeah.
And that was going to be what I was going to add to the conversation is even when they do develop a vaccine, this virus is still more than likely not ever going to go away.
Exactly.
Because you have people out there that aren't going to take it. They're not going to go get vaccinated against it. And so I think that's where what Mark said earlier is so very important. It's here. We have to learn to live with it.
Yeah.
That's all there is to it. And living with it is washing your hands during peak times, more than likely, possibly, doing what you have to do when you go out in public to keep yourself and others safe. And if you are of that vulnerable population, you have to be more careful than everybody else. And we all hate that, but there's personal responsibility that has to be taken here.
There is personal responsibility, and you kind of touched on it, the vulnerable population. We will always continue to focus on that vulnerable population.
Absolutely.
And Commissioner Bryan and I have had multiple conversations on what we do with our nursing care facilities.
Right.
We've been working over the last several weeks of testing every staff member in these assisted living facilities and nursing homes. The governor the other day recommended routine testing. We don't know how that'll shake out and how it'll eventually look, but until a vaccine is available, we can see the potential of continually going back into these facilities, checking their staff to ensure that infections are not brought into those nursing homes from the outside. And I mean that's the reality. We get a vaccine. You hope the vaccine gets out. It gets with your healthcare professionals, your first responders, your vulnerable population. You focus on theirs. You hope everyone in those populations will take the vaccination. Then you hope the public who doesn't fall into those categories, when it's offered, they would take that same vaccination, understanding that they themselves may not be infected by or affected by the virus, but they could infect somebody else who would be impacted.
Right. Looking forward, going into now, we're just in the first week of June. As much as we talked about numbers, where you guys? Because I know you look at you like to look at trends, look at scenarios and stuff like that. So let me ask you, partner, as far as the end of June, getting into July, we're talking the middle of the summer, where are some of those trends expected to be? If we're already talking low percentages already from a lot that's been tested in the last 2 weeks of May, where do you guys see the next few months going?
I see still focusing on, major efforts on nursing homes. Like I said, that will continue on.
Right. Should.
Our push right now is the messaging piece, because what I've seen just for the start of the month, several cases coming in already this week have been, we're seeing the families, some family cases coming in, so the numbers may pop up a little bit there. So it's really getting that focus on understanding how to take care of your families. Then we have to look at, and there'll be discussions coming down from the Board of Education on what do we do with August, September, when we start rolling around, and how is that going to look for testing? What will the department's responsibility be at that point? When it comes to education and testing, I think these are all little things that we're keeping on our radar. So I'd much rather have the county prepared and our staff prepared, in advance than for someone to pop in and say, okay, you've got to test this many thousand people in the next 2 weeks. Okay, well, we've already got a plan. We've already started. I really, it's very hard to forecast this virus at all. But with us, it's continuing focusing on vulnerable populations that don't necessarily seek out health care, trying to work with our community partners. We're getting ready to do a big push in the community, starting with some of our faith-based organizations, providing reusable cloth masks. Well, the department got a big shipment in yesterday, and we've already contacted several of our churches and several of our community partners to help us distribute that shipment out into the community, and then we'll be ordering more masks that come through. So in the event you may come into a congregational setting and where the social distancing is rough, but if you can have these other mitigation practices in place, we would encourage that. And we want to do everything we can to make that possible.
Absolutely. Thanks, Mark. With just a few minutes, we got about 4 minutes left. Kathy, I wanted to turn it to you with the idea of some good things in mention of what we have the talking points based on the Dollar Tree construction and how that's looking to...
It's looking great.
Yeah.
If you haven't had a chance to ride out there, you should certainly take a drive by. We would have thought that project would have possibly been put on hold or during this whole thing, and they actually went the opposite direction and they expedited things. So that project is coming along a lot faster than we had anticipated, and it's going to be a tremendous asset to Marion County and to the southwest part of Marion County. They've already got about 50 they've already put out 50 job offers.
Yeah.
And they'll have 240 jobs in their first phase. And I think it's important for those who don't know that the capital investment into our community from this project is $230 million.
Wow.
So I think that speaks volumes about Marion County and about our community, that even during this COVID-19 event, you still have businesses that want to invest in Marion County like that.
Yeah.
So it's a really great project. And, hey, we got the phase 2 yesterday, which was a good thing. A lot of our businesses phase 2. Starting tomorrow. So I think with that being said, the points that Mark hit on as far as we still have to follow our mitigation practices so that we can continue to move forward and so that we can continue to show our leadership up at the state level that Marion County's got this.
Yeah. Phase 2, what is all that together? I looked at that earlier, but we're talking...
So what they've done in this part of it is restaurants and other establishments, bars have been able to open up, pubs have been able to open up. They are supposed to still be at 50% capacity.
Gotcha.
Also, our restaurants that have a bar area can now have customers seated at the bar and able to enjoy their food or whatever they want to have. Bowling alleys, movie theaters, they're all able to open up. They have, at 50% of their building capacity. Personal services, tattooing, body piercing, acupuncture, tanning, and massage may now operate. So it's pretty much opened up. I can't think of anything that hasn't been able to open up now at this point.
Right.
They're just limiting capacity at some places. Right,
which is, good news. Open it up. That's what we were talking about.
Open it up. Let's get people, not only do I think that opening our businesses back up is very important, but we also have to get confidence back up in the public to go out.
Nailed it.
To our different establishments within our community that are open.
And with this phase 2, I think that'll bring that little bit of confidence and everything else. But like we said, Mark, still practicing on the air responsibility, and that's what's important.
Absolutely.
Yeah. Thank you guys very, very much. County Commission, as we do to round out our show on Thursdays. Kathy, thank you very much. Mark, it's good seeing you again, my friend. Thank you very much for coming in. It's good to hear that information. She always backs you up, but it's good always for the listeners to hear that from the horse's mouth nonetheless. And that's good news, like I said, with that question of what we see with June and July. For those who didn't know, we did a lot of testing in May, and that's important for them to know.
We are over almost to 15,000 now.
Almost to 15,000 tests being run.
Yeah, awesome. Excellent. Well, thank you guys very, very much. It's going to be a wet weekend, but do what you can to enjoy it, all right?
All right, man.
Excellent. For AM Ocala Live, that'll do it for us today, this Thursday. Stay tuned. Hey, we made it to Friday. And with that being said, too, phase 2. So it gives us an opportunity there with our movie theaters, bars, restaurants, all that good stuff. So let's do it. And until tomorrow, as I say, stay tuned for tomorrow. WOCA Ocala. Until tomorrow, goodbye.